Hi, everyone. I'm Steve Kepp, co-founder of From Day One, our forum on corporate values. Welcome to today's webinar. We're excited about this topic, which is looking at how employers can support workers in caregiving roles, given the variety and the complexity of people's healthcare needs. Before we get started, I want to share something special we have for today's attendees. One of our monthly virtual conferences is coming up on Wednesday, March 9th, and it's titled Enhancing Total Rewards to Fit the Workforce's New Expectations. It's going to be particularly valuable for employers who want to know which benefits and features are most important to workers in the post-pandemic era that is coming soon. Thanks to our partners, including today's sponsor, we have some complimentary VIP tickets available for those who join today's webinar. That would be you. I'm putting a link in the chat. You'll want to take advantage of this one because the regular price for our conference tickets is $149. And this link will give you a free VIP ticket for the whole day's activities. Now, today we'll be exploring the topic, how employers can support workers in their caregiving roles. When companies make an intentional effort to help employees with caregiving responsibilities, everyone benefits. Yet today's every family's healthcare needs are different, many with complex or chronic conditions. How can employers help workers navigate these often complicated challenges, as well as advocate for them? And what are the potential benefits for the company in terms of worker retention, productivity, and progress in terms of diversity, equity, and inclusion? Our sponsor today is Wellthy. I'll tell you a bit about them. Wellthy is a digital caregiving concierge. Wellthy uses dedicated care coordinators and a seamless technology platform to project manage healthcare for families with complex, chronic, and ongoing care needs. Wellthy takes the pain out of healthcare, scheduling appointments, finding the right specialists, researching treatment options, managing insurance, organizing records, communicating with family members, and much more. Wellthy adds a layer of much needed customer service to the health system, giving families help, hope, and peace of mind. Wellthy partners with employers to deliver an affordable, scalable, and compassionate solution that's changing the way families experience care. Now, a few quick logistical items. This webinar is being recorded and will be available on demand soon after the event. So you can look out for an email in about 24 hours with a link. That email will also have info on how you can get professional development credits for this session from both the Society of Human Resource Management and the HR Certification Institute. And look out for a written account of the conversation on our website at fromdayone.co. Now, for you participants, about 45 minutes into the webinar, we'll have a Q&A session. You can submit your questions anytime you think of them using the Q&A button at the bottom of your screen, and our moderator will pose them to our speakers. Now, I'd like to introduce our MC for today, a most extraordinary moderator, Lydia Dishman. Lydia is a staff editor for Fast Company, who's an expert on topics including technology, leadership, and the workplace. Lydia has also written for CBS Money Watch and Fortune, Popular Science, and the New York Times, among others. Okay, Lydia, take it away.
Thank you so much, Steve, and thanks everyone for joining us for this very timely and important topic. We're so glad you could be with us today. I'm sure that you've heard this phrase before. We're all in this together. We've heard it countless times over the course of the last couple, almost 3 years. Yet everyone's experience of the pandemic, fight for racial justice, and even natural disasters is unique and deserves to be treated as such. Yet as we collectively experience the so-called Great Resignation, employees have more leverage than ever to get specific needs met, both personally and professionally. And among those needs is the flexibility to care for our loved ones, not just children, but all members of our family, extended family, close friends. While this looks different for every individual and family, employers are beginning to realize that this is becoming a necessary part of compensation, along with benefits that extend beyond traditional healthcare coverage and 401k. And especially since the most recent figures that we have, I was scouring, and really the closest thing I could get was from 2020, which seems like a million years ago, is that 45%, that's nearly half of employees, are caregivers. So to discuss this evolution, we've gathered this group of professionals from various industries and backgrounds. I'm going to ask them to introduce themselves and tell us about their work. And also, pointed question as you introduce yourselves, tell us whether or not you've had personal experience or know someone who has toggling with caregiving and work, and what stood out for you about this? Kerstin, let's start with you.
Sorry, finding the mute button. Yeah, I'm Kerstin Aiello from Synopsys. Synopsys is a tech company headquartered in Silicon Valley. We have 4,500 employees in the US and 16,000 employees worldwide. Probably have never heard of Synopsys because our customers are actually other tech companies. So getting to your question, the thing that struck me most in the stories that I've been hearing throughout the pandemic, we did get a lot of concern from parents who are trying to work and also help their children, do their remote learning. But what really stood out to me were the parents with kids that had neurological differences or learning difficulties. And it just seemed to be like 10 times harder for them. So that's the group that really stood out to me.
Okay, thank you. Liz, any personal experience or know someone who has? And
Yeah.
Also tell us what you do.
The author of Working Daughter, A Guide to Caring for Your Aging Parents While Making a Living, and also of the Working Daughter, founder of the Working Daughter community, which is thousands of people who come together to support each other, balancing elder care and career. And the working title of my book was How Not to Lose Your Marriage, Your Sanity, or Your Job, but it was too long for the spine because my experience was both of my parents were diagnosed with terminal illnesses on the same day back in 2014. And working and caregiving was the most difficult career challenge I've faced ever. I was a working mother, but the elder care piece for me was absolutely brutal.
I was in that boat and walked many miles in those shoes as well, taking care of both of my parents. It is quite a chore, and managing family and work. Amazing. We're still standing though. So yes. Diana, how about you next?
So good afternoon, everybody. My name is Diana Grubard. I am the Director of Benefits at Northwell Health. Northwell is the largest employer in New York with the largest health system with 76,000 employees. No surprise to anyone, the pandemic hit us especially hard. What we learned throughout the pandemic was not only was the childcare need evident, but also the need to care for your parents. The baby boomers are retiring, the millennials are entering, and they are responsible for caring. We recently started a business employee resource group to allow everyone to come together so that we can start to create programs that can help meet these needs. So very happy to be here. Thank you for having me.
Thank you. Sara, introduce yourself. Any personal experience with this?
Hi, everyone. I'm Sara Ahlfeld. I'm the head of benefits for Sanofi in Canada. I do have personal experience. I'm a single mom. So especially going through COVID with the children learning at home, it's been quite a difficult journey, especially in the beginning when we were all looking forward to it. One of my children has mental health issues. So that made it especially challenging. So supporting caregivers is something I hold very dearly.
Absolutely. And again, you're still standing, so congratulations. Last but not least, Lindsay.
Yeah, Lindsay Juris, and I'm CEO and co-founder at Wellthy. I am also a working daughter, officially part of Liz's phenomenal community. And yeah, I was a caregiver for my mom for 28 years. She battled primary progressive multiple sclerosis. She passed away about 4.5 years ago. Through the pandemic, we juggled 3 older kids, little toddler, watched our grandfather pass away, and we've been through some stuff with my mother-in-law. So caregiving journey continues here on my side.
Wow. Well, again, hats off and congratulations for making it through and being with us today. Thank you. Diana, I want to come back to what you were saying in your introduction about starting that employee resource group. So was that because there were so many people coming forward? I'm just more curious to know what the trend line is. What are employees saying that they need most as we approach this 3-year mark?
Yeah, so it's definitely something that came about from feedback from our surveys and the other business groups coming together. And we found that we needed to take, as an employer, a deeper look. What benefits do we have? You know, you mentioned before, it's not the cookie cutter benefits anymore.
Mhm.
Our employees are looking for that uniqueness. So whether or not we're offering time off, or whether or not we're partnering with other organizations that can help us. So something as simple as, how do I provide my employees with, you know, maybe someone that can watch their parents so they can work? Where, you know, we work in an area where I need people to come to work. I need my nurses to physically be there. I can offer them maybe the flexibility of schedules, but when they're there, what resources are available? Maybe someone can help watch their parents at home, watch their children. Childcare is certainly another area that we're developing, and we're constantly looking to grow. And it's not just about the toddlers. It's how do we make sure that there's tutoring benefits? How do we make sure that there's those additional benefits for those that may need a little bit of extra help?
Kerstin, what is the workforce there saying what they need the most?
Yeah, as I said before, they were mostly struggling with the remote schooling and their own work. Fortunately for us, most of our employees, it's not hands-on like a medical caretaker, right? So there could be a lot of flexibility. So we spent a lot of time coaching the managers on how to have those conversations. I think sometimes managers don't realize how much flexibility they really could provide. You know, maybe a certain half hour or hour in the morning, somebody needs to get their kids onto their Zooms. You know, maybe they need another half hour midday and another half hour at the end day. But, you know, if they're doing their work, honestly, at 10, 11 o'clock at night, it's really okay. So, you know, we did provide a lot of guidance. The other things that we did, this was a huge hit, and it's probably a little bit outside the box, but we bought all of our employees in the US and also in Canada a Dash Pass. And that was really very well received. So it's not that expensive. It cuts out your delivery fee and it saves maybe half on the other fees. But it really, I think, gave people permission to not have to worry about dinner every night and, you know, have some food brought in. So that was one of the things that we did to try and help out, in addition to working with the managers and giving them guides on how to have those conversations.
Yeah. I want to actually dive into the conversational aspect of this a little bit later in this, but I really want to kind of get a sense of what the trends are. And so it's interesting that you're saying that, you know, given the Dash Pass, people need to eat. And sometimes that's the last thing you feel like doing. Sarah, again, single mom, like, but what are the people at Sanofi saying that they need the most?
That's, you know, an interesting question. We've just begun our well-being journey in Canada, probably about a year ago. So our focus now, what we were hearing from employees is, you know, more around, you know, flexibility of benefits, flexible work time. But even though they weren't talking about it, we took the initiative to think about it on behalf of them. We know how hard it is for people to balance their lives. We want our employees to be well. So we've gone ahead and introduced different programming that we thought could help them out, like, you know, free backup childcare, free backup elder care, tutoring services, even things like online fitness programs where they don't have to worry about whether or not they can get out to a gym. They can do it right at home. So, in addition to that, we've got flexible work time. So like Kerstin was talking about, you know, employees have the opportunity, as long as it works with their area of the business, to organize their day so that it suits themselves. So whether it's, you know, working in the morning, early in the morning till early afternoon, or working, you know, sort of starting in the afternoon and working into the nighttime, or taking breaks in the middle of the day. They can pretty much do what works for them. And I think a lot of people appreciate that. You know, it sort of helps to maintain their mental health and being able to get the things done that they need to get done in addition to work.
It's incredible what a little bit of permission can do to
Exactly.
ease your mental burden on that.
Exactly.
Liz, what is the community saying? What do they want the most?
Definitely flexibility. I mean, they're scared that if ever we return to some kind of normal, whatever that next normal is, that will go away, and that people will think that was a COVID need. For them, it's always been a need and will always be a need. And then the other thing that comes up isn't a benefit, it's compassion.
Yeah.
It's sort of what you were saying, Kirsten. It's managers who are compassionate. A woman shared a text in our community, and it was a text she sent to her boss she worked for 30 years. And it was, "Mom's in the ICU, some kind of infection. She might not make it. It won't be in today. I'll keep you posted." And the response was okay. I mean, and so they just want their employers to know, if you have my back, I'll have your back, and I'm doing the best I can.
Absolutely. And it doesn't take that many more letters to show compassion. Some people just aren't really good at expressing themselves. And so, yeah, I want to return to this a little bit later in the program. Lindsay, so same question for you. You've got a different perspective on all this. So what are the needs?
Yeah, I mean, I see it both ways, right? I
Mhm.
employ a couple hundred people on my team at Wellthy, and so we've certainly seen it up close and personal with our team members and heard the struggles, especially sandwich generation employees dealing with kids in the home and parents and other loved ones that they're taking care of, and their own COVID kind of concerns, right? Pushing through a diagnosis or situation. And then what we've seen with, we've identified that caregivers really come to Wellthy, we see, in one of three states. One is just to get their head around a game plan. Parents who are saying, like, this isn't sustainable. I just need to I need better infrastructure. I need a sense of what my options are. So that kind of getting a game plan in place. The second thing we hear is families coming to us saying, I need help getting things done. I physically don't have the time in the day during my working hours, during the work week, to call around, understand pricing, availability of whatever care services that I need to set up. I need help getting things done. The third thing is, and this is, I think, to Liz's point, we hear caregivers saying or expressing the need to feel less alone. Caregiving is very lonely. It's still it's stigmatized, and I don't think people often feel comfortable sharing what they're going through. And so we hear people coming to us and saying, like, is this normal? Is what I'm going through, especially over the top unique? Just that sense of kind of connection and shared kind of experience. So that's kind of what we're hearing.
A few years ago, I did a story on how much it would really cost to offer childcare benefits to workers. And I had interviewed some companies that were offering that as a benefit. And they were smaller organizations, so they were able to sort of jigger those resources and make it work. But one of the striking things that all of the people that I interviewed said was, we thought this was going to be a bigger deal than it was. And it turned out to be doable. And so this is kind of what I'm thinking about at this stage of the game is I think that there is still a large amount of misconception around what it really takes to support employees who are caregivers. And I'm wondering if there is something that can be done or something that you've already put into practice that is fairly simple. Diana, you're nodding vigorously. I'm going to come to you first.
Yeah, so we spent the last 2 years really focusing on well-being, and we've done a number of different things. We have the backup childcare, the backup elder care. We recently partnered with a group to do subsidized childcare. Also with that comes an elder component too, so that you can call someone, they can come, they can essentially watch your parents, watch your loved ones while you're working. On top of that, we've also taken another approach in terms of our education. So with our financial well-being, aspect, we've actually added in a caregiving component. So we often have caregiving seminars. We invite our board members. We also invite our employees. They can come, they can attend for free. We offer them at all hours. They're also recorded and on our employee resource group. And the last thing that we did because of the pandemic, and we saw how many of our employees were, just really struggling, is we also made a caregiver support fund. So we actually have funds that our employees, both the community and our internal employees, can donate to. And we have an application whereby our own employees can submit and receive funds. So, if you're caring for someone and you have unexpected expenses, you can submit an application, we review them, and then we can help financially reward our employees. And that's gone so far within the last 2 years.
And the funds for that come from donations?
They come from the donations. Yeah, they come from the donations, both internally and externally, and the community is donating.
Yeah.
People want to help each other.
Yeah, well, that's so encouraging to hear. And I know that we have a number of attendees who are working at smaller companies who may not be very well resourced, but if this kind of program does rely on donations, well, then that is something that they can tap into. Sara, I know you said you're at the beginning of this journey at Sanofi, but were there any major misconceptions that you had to sort of get over to get buy-in for the things you're doing?
Cost was a big one. We our budget for benefits in Canada is much smaller than our counterparts in the US. And so, trying to emulate what was offered to our US employees was a pretty scary endeavor, simply from a financial standpoint. But I was really surprised to find out, how reasonable certain programs are that can help our employees in a similar way. For example, our backup childcare program, we were able to, we purchase a certain number of days or visits per employee at a very reasonable price. And then we're able to offer a discounted rate if they need more above and beyond that. Similar with the elder care, offering our online programs like mental health providers and online fitness, which also help caregivers keep their sanity. We were able to find providers that offered discounts, like for example, for mental health, they pay, a quarter of what they would pay in a brick and mortar therapist, and they're able to claim that through their benefits. So, it's not that we're paying for the whole benefit itself, but we are offering employees an opportunity to, keep their finances in check while accessing the resources they need.
Kerstin, any big hurdles you had to get over? I mean, you were talking about coaching leaders to have those conversations. Did you have to get buy-in for that? Was that one of the misconceptions?
Well, during the pandemic, I think there was a lot of realization about people's stress they're going under and their family responsibilities. So it actually, for me, was an opportunity to get some things over the finish line that I hadn't previously. One of those was Rethink. And that's a support system for people who are caring with either children or sometimes they're even adult siblings, but caring for a family member that has neurological differences. So there's certain number of hours of counseling available, specific on that topic. And then the materials that were available online, really any parent could use them. They were really wonderful resources. So that was something. And then similar to Sara and Diana, I'd really wanted to get a sick and emergency backup program going. And so especially with concerns about some daycares not having made it through the pandemic, I was able to get that going. And we thought, people may be reluctant right now to have someone come into the home. And, it's going to take a while for them to understand it. And actually, it really took off. And so we started in May, and by December, we had used up all the days that we had purchased for the year. So we just recently replenished those. And, similar to the pandemic, I think leaders are concerned about the Great Resignation. So if you can figure out, which portion of your population, kind of like which age band is where you're having the most turnover, and then, can sort of connect the dots as to what would really support that group. I think, there's an opportunity right now,
Right.
that leaders will listen.
Absolutely. Lindsay, in broader terms, tell me about common misconceptions and what you can do to get over them.
Well, I think, and these, I think the panelists bring up really great ideas. I will say, I think what we experienced at Wellthy through the pandemic, a lot of employers, the concept of backup care is a very familiar concept. A lot of employers offer backup care or emergency care. And that's great. But what we saw through the pandemic is more so that families were struggling to set up care infrastructure to get care, period, not backup care, to get like actual
Any care,
everyday care. And so, there are massive shortages right now across all areas of care. In-home care, it's really hard to find daycare options if there's any sort of special need that a child might have, whether that's neurodiverse needs or some sort of physical disability. It's very challenging. And then just on the elder care side, it's very challenging to find in-home care and long-term care facilities, all of that. And so, I think backup care is helpful. I think we're going to continue to see employees struggle with just establishing care infrastructure for themselves, for their family, and especially as care needs evolve, right? You establish care infrastructure, and then a couple months later, mom's dementia progresses and she needs more care than was previously set up. It really is kind of a never ending, for many caregivers, the average length of a caregiving situation is 5 years. I mean, it's really a continuous, ongoing effort. And so I commend the employers that are setting up backup care, and I think that's a great first step. And I would just encourage employers to think about helping employees set up care infrastructure as well.
Absolutely. Liz, you sparked me thinking about my personal journey with this. And I remember, and this was way back in the before times when I was taking care of my mom, that it was, I kind of went like shaking in my shoes to ask my boss if I could work from home 2 days a week. And this was really in the before times. Is that a misconception that you find that, the members of your community are struggling with, that because it's elder care that somehow you kind of don't need to be there as much?
I think so. Maybe not expressed in that way. I think it's just so elder care is still invisible in the workplace, and I think, back to misconceptions, one of the things our community talks about is, and we don't mean to complain, because, back in the way before, when I was caring for my parents, 2014, 2015, no one was talking about elder care. Now it's in the conversation in the workplace. So we're grateful. So I don't mean to complain, but the fear and the misconception is that it's like childcare, that there are similarities. And, some of the big differences Lindsay was just pointing out, backup care is wonderful, but when you're dealing with an adult who has autonomy, assuming there's no cognitive decline. Like, I could take my son when he was 18 months to daycare and he'd be kicking and screaming. I knew it'd be fine the minute I left, right? And I could just say, well, you're going here anyway. He didn't have any say in the matter. I couldn't force my dad to get a home health aide or move to assisted living, or, so there's so many differences. And I think because it's so uncomfortable, we don't talk about it at work. So sort of back to the point you were making, Lydia, people at work might be like, oh, my little one was up all night, and you share diaper stories, and you share funny drawing, with crayons on the wall stories, and whatever it might be. You don't really share those stories about your parents because, one, you respect their privacy, hopefully, And two, it's really intimate and sensitive. So I think that's why there's this misunderstanding, and that there's this like one and done, and people don't realize what elder care entails.
Yeah, absolutely. So obviously we need to talk about these issues more on, all parts of this spectrum. So how are we teaching our managers and leaders to have these conversations? Kerstin, I'm going to come to you first because you had introduced this concept early on. So what specifically are you doing?
So we provided on a couple of occasions guides on, exactly the questions to ask. I don't know, maybe we don't have a lot of confidence in the managers, but a whole series of questions about what their physical needs were at work, like did they have the appropriate monitors at home, and all the things like did they have a good chair, and like your dining room table chair is not ideal for 9-10 hours or whatever. So we had a whole series of questions on those, and then a whole series of questions regarding needs in the household because of the family and what kind of flexibility that a person might need, and just really encouraging them that flexibility is what people needed most of all. And I also like the comment about compassion, right? That, okay, like, boy, there was a lot more that could have been said there. But that's really how we went about it.
Okay. Diana, did you have to coach any managers on how to have tough conversations?
So we're just so large that it's a very, I really have to agree with Liz. We talk about children, we talk about childcare needs, but I don't know that we train our managers to offer flexible schedules, to have the compassion, to have empathy, but I don't know that system throughout our entire system, we're really having those individual caregiving needs. You're having that individual conversation with your manager and you're asking, may I work 7 to 3, and wherever we can, we try to, accommodate those flexibilities. But I definitely agree that there's a lot more room for improvement. And these are conversations that we need to continue to have. And I think to Lindsay's point, the care is so different than you may have for a child. And this conversation needs to continue to evolve. Our programs need to evolve. And, I definitely think that there's room for improvement.
Sara, do you have anything to add there, or you have any best practices?
Not so much, but I would agree that that in general, it's important that we do provide the support to the managers. Often, culturally, there's this idea of, don't get personal, keep it work related. And so it's, we're going to be introducing some training in the fall this year about that involves, that it's okay to get personal without overstepping the boundary that the employee is comfortable with. So, really, really encouraging managers to talk to their employees about how they are doing and what they need, what kind of support, they're looking for in order to make their lives outside of work a little bit better.
Absolutely. Lindsay, slightly different question for you but definitely about conversations. I'm thinking about as we sort of are approaching maybe another threshold where people may go back to the office. I know that people, especially caregivers, struggle with this idea of presenteeism. If I'm not there, then I'm going to be discounted. I won't be up for a promotion, whatever. Is there some way that you would advise managers and leaders to kind of take that in hand? And, I mentioned permission before. Maybe it's as simple as that, but what do you recommend?
Well, Lydia, I love the question, and I think it's just the right intention. And Kerstin, I love hearing the manager training. it's interesting when we've seen companies through the last 2 years roll out Wellthy and see very successful adoption of our program. There's one trend that's pretty consistent, which is that the communication comes from the CEO or someone on the leadership team.
Okay.
And it's really less about talking about the Wellthy program, but more so making a larger statement that the company sees caregivers, wants to support caregivers, sort of opens up the dialogue, normalizes the discussion, and that really does make a huge impact. We see for kind of the managers and team members within that company to feel comfortable having open conversations about caregiving and talking about solutions that might be appropriate for their own needs. So that's one thing I'll throw out there. And by the way, like, separate topic that's really interesting, we have a disproportionate number of large clients with female CEOs who have taken it upon themselves to roll out Wellthy and announce it themselves. So I'll leave that one there, but there's some connection, I'm sure.
Yeah, maybe it does pay to walk a mile in those shoes in order to make the business case for it. Liz, slightly different, but similar question. What do you wish a manager would say to you if you're struggling with all of this caregiving responsibility and trying to get your work done?
Wow. Wow. I wish I had a great answer for that, because I should have thought of that. It's not so much what they would say, it's that they would listen. It's that they would have, I think, maybe the training behind them and the courage to be in the conversation. My experience personally as a caregiver has been, that I'm sort of untouchable, or I think we're aware that we make others uncomfortable. And I didn't share this in the upfront, but I also then became, after my parents passed away, I became a spousal caregiver. I'm now a widow and a solo parent. So sometimes I feel like a leper, like managers are like, oh, I don't know how to touch her. And so I think if we could, back to Kerstin, if we could train them and give them the support. And Sara brought up a point too about supporting the managers. It's hard work.
Yes.
I mean, I think that's important. I'm here as representing caregivers wanting all these demands, but I think it's really important that we understand that it's really hard to manage that Lindsay's in Monday and Tuesdays and Kerstin's in Wednesdays from like 1 to 101 and back at 103. I mean, and the manager's worried about picking up that slack, and somebody mentioned saying the right thing. So I think I would just wish that the managers had the courage, and the strength to just listen and, not be afraid of me. It's not contagious.
Well, and that brings up another point, because first of all, the most recent stats, I believe from Pew, suggest that of all the different ways that we've sliced the fact that everybody's burnt out, we're crispy fried after all these years of this, that frontline managers are experiencing the most burnout still. And it's making people not want to be managers. But I'm asking how they can balance this, as you're saying, Liz, maybe somebody's coming in at this time, this one's got a different day. How do they balance the personalized approach with the needs of other workers and performance expectations? Like, what is I know there's no silver bullet, but Diana, do you have some thoughts on that?
We do a tremendous amount of training. So we try to, from mentorship to, empathy, do put all of our frontline and our senior leaders through a training. You hope that they can, retain some of the information. You hope that they leave and they have those empathy skills, they have those soft skills, they try to make the personalization, but it's hard. It's definitely a struggle. I think, going back to Liz's point is, you have to be able to have those crucial conversations, and you need to be able to do something about it.
Wanted to add?
Yeah, the other thing is if we can work on sort of what I call the don't ask, don't tell policy, not the one that we read about in the media, but
different webinar for another time.
train managers and employees, I think, to talk about what you said, like the work and the accountability. So I can say, remember, I'm going to be leaving Thursdays at 2, and you don't necessarily, as the manager, ask me why, and I don't necessarily give that up. Instead, we make sure we have a conversation about, here's where the work stands, here's where the backup and the redundancy is, here's how you can reach me, and make it about what needs to get done for the business. So then managers aren't in a position of saying, you know, Sarah's kids trump Diana's cat trumps Lindsay's, you know, grandfather. And so we make it about the work. I think that helps too.
Sarah, did you have something?
Yeah, and I think it's about trust. You know, the pandemic has been really great in showing that employees are as or more productive working out of the office as they are in the office. And so, you know, it's not about clock watching or, you know, seeing what time someone takes their coat off and what time they get back from lunch. You know, it is more about the work, being accountable for results, and allowing employees or trusting in employees that they can manage their day in such a way that it suits them and they can meet their objectives.
I think, you know, as you said, rightly so, this whole experience has been a trust exercise in a certain way. And we really had to rethink where work gets done, as well as how work gets done, and what we're really measuring. And I'm also thinking about it in terms of engagement and how benefits get tailored based on what you're hearing employees are really engaging with. Kerstin, do you have some insight there? Anything you changed in the last year or so?
Well, I mean, thinking about flexibility, we've organized a whole different hybrid kind of environment where now some jobs are completely remote, even if they're local. I have two employees that will be completely remote, one who will come in 1 or 2 days a week, another one who will come in 3 or 4 days a week. I'll probably come in 4 days a week as well. So I do, you know, not that I would have ever wanted to go through this pandemic, but I do think it has shifted everyone's thinking, that there is more trust and there is more flexibility. And the days of a CEO looking to see how many cars are in the parking lot, that's behind us. So I think that's a really good thing. And, you know, for me, it did offer some opportunities to get some things over the finish line that we had hoped to do, but we're really struggling to build the case. And I think we're still in that window of opportunity. Leaders are concerned about the Great Resignation. So I do think this is the time. If you have ideas that you think will support your employees, you know, this is the time to bring it up.
Lindsay, some insight there?
Well, I'll just share, I'm going to steal somebody else's quote recently. Ben Carter, who runs benefits, lovely human, runs benefits for Workday. He said recently, companies of the future, kind of even companies that are going to win kind of in this environment that we're in now, will help employees structure work around their life versus the old model of structuring your life around your work, right? And it's pretty profound. You used to go to the office from 9 to 5 and you knew outside of those hours you did life. And the kind of newer model is a little different. You know, you have your life and then you're going to do your chunks of work around that. So I think that's just a newer approach, but I'm optimistic and I do see a really exciting moment in time. I think Kerstin, you nailed it. You know, employers are thinking about their employees and unique needs of different types of workers and how to support, single moms and caregivers of parents and parents of young children. And you're really kind of considering each of these and diversity, right? Like it's the first time in history that we're really thinking through different needs of different types of diverse workforces. And so I think that's very promising.
I'm also thinking about it, of course, in terms of attracting and retaining talent, because even though some researchers would say that there actually isn't a great resignation, we do know that there are large amounts of people who are even just rethinking their life choices and wondering if they should take another job. So how do caregiver benefits factor into attracting and retaining talent? Diana?
Yeah, so at Northwell, I think it's really part of our overall total well-being strategy. I think we try to really offer a more holistic and comprehensive benefit package that's inclusive. We try to understand the needs of our diverse workforce. Our values focus on the importance of caring for our employees, our patients, and our communities. And although we see the impact of the Great Resignation, I think our focus on ensuring that we're driving towards our employees' well-being, I think that's really our value proposition. I think as long as we continue to make sure that we're doing what's right for each employee, and we have our survey data, we have our burr groups, we're constantly training, developing. I think that's really what's going to differentiate us in this new world.
Can I ask you, because I know there are a lot of curious HR leaders out there, how are you communicating it both within and without?
So when you're 76,000 employees and you span across all of New York, we have an amazing communications team. Not only do we have our internal, we have our news releases, we have our manager training, we also have bi-weekly HR leader training. So we are on conference calls every other Thursday. We also use social media. We have a huge Facebook following. Anyone that works at Northwell is constantly seeing my posts out there. We use text messages. We use our screensavers. So there's so many different ways. We also do tabling events. I mean, I hate to say it, but throwing a table in the cafeteria, and it goes a long way. Employees enjoy seeing people. When we were doing a few weeks ago, we were doing a huge financial well-being initiative. We put tables in every single cafeteria, spread the word. And I think that really goes a long way.
Yeah. Sometimes analog really is best.
Yeah.
Sara, any thoughts there? How you communicate within and outside the organization?
Well, again, we just sort of began our journey recently, but one of the big things we did was consolidate all resources into one place. One of the things that we were hearing a lot is, people don't know that programs exist because they don't know where to find them, or they don't know where to go to see what's available. And so we created this, this one-stop shop where employees can access anything total well-being, so they can see what's out there and what they need for themselves. We utilize the resources, any resources that we have available to us. So whether it's on-site screens, one of our locations actually has an on-site newsletter that goes out. We've got, traditional emails. The company uses Yammer. And we also engage with our vendors to promote other programs or offerings that we have. So, someone may contact one vendor for one thing, but that vendor is aware of other resources that Sanofi Canada offers its employees, so that they can say, it sounds like you might also need help in these other areas. And so they can help spread the word for us.
That's helpful. Kerstin, anything to add?
Yeah, so similarly, we do have a site where we've gathered everything, and our newsletters always point people to the link in that site. We made it an internet site so that spouses, domestic partners, or other family members who are interested have access. It's benefits.synopsys.com. You can all look at it. And
Everybody get that?
yeah, that's not hard. SYS, Synopsys ends in SYS. So I also think as we're bringing on vendors, we should look at how they can meet all the needs. So like if you're looking at a sick and emergency backup vendor, can they also provide consultation on elder care? Can they also point people to available daycare? Can they also provide tutoring? Like it shouldn't be just one thing, right? It should basically, there should be something there for every kind of family. Same thing when you're looking at your financial assistance programs, right? You have some people that they're just out of school. They need to learn how to manage any debt they've come out of school with. Maybe they've never budgeted before. Who should I get a credit card from? Or, some really basic things to the other end of the spectrum where somebody's approaching retirement and like they've spent their whole life accumulating. And now they need to learn about deaccumulation, which is something we haven't really done a good job of focusing people on and teaching them about. So presently we are getting ready in March. We're going to do a couple of focus groups specifically with DE&I in mind to understand, what are the gaps that we have. We've also hired Mercer and Fidelity to look at all of our benefits and let us know, where we might not be reaching everyone, because, I also have my blinders. So just, getting some other people to take a look and find those things and then prioritize addressing them.
Absolutely. We have some little bit of time left. I want to get to some audience questions. Charlotte poses a really good one. How can we support employees who have less flexibility, i.e. call centers? Which I think is definitely a large portion of the workforce that can't be hybrid or remote. Insights on this, Diana?
Yeah, so we actually have several call centers. The HR call center that we have is actually currently remote for those that wanted to stay on site. We did allow 25% of the workforce to stay on site, especially for training purposes. We also created flexible schedules, right? So we broke up break time. So we have, half the population that starts at 7, and then we kind of stagger it. Along with that, we also stagger lunch times. And then they do close every other Friday for about an hour for training purposes, just to share information, best practices. And that's actually been very successful for us. So
very helpful. Lindsay, you wanted to add?
Sure, I'll add. I mean, it's always interesting for me because I'm often on panels where folks are talking about flexible work and the beauty of that. But, I look at you, I mean, Diana, you're the perfect example. In your organization, flexible work isn't really an option for most of your employees, right? So we see that frontline workers, call center workers, retail workers.
Someone's asking about warehouses too.
Warehouses.
So, Christina, yep.
And I would argue caregiving support is more important for those workforces because of the fact that they don't have flexibility. And we do see caregiving as a major reason for missed shifts, arriving late to shifts and burnout and retention issues. So I would say one critical thing is for your call center or retail or, shift workers, it's really critical to provide benefits that have different modalities of engagement, so where your employees can download an app and just message or text to get support. They can correspond after hours or on weekends when it's convenient for them. Oftentimes benefits are only available, through a 800 number during working hours. And really, frankly, we think those types of benefits often don't serve a whole bunch of workers all that well.
Well, the audience is really stepping up now. Lee wants to know what's the best way to get the word out about what kinds of assistance the employee might need, because many employees are not comfortable doing this. We've had this question in a previous webinar. So there's another trust issue, which I believe goes back to those courageous conversations. Anybody have a best practice to share with Lee? Go for it.
Sorry to steal
No,
all,
no,
the,
yes.
all the air. You know, we've seen Facebook, now Meta, do this extremely well. They do anonymous surveying where they ask employees to share who is in their circle of care. And that's very critical language because, and they explain what circle of care means. And I love that language because most people either don't feel comfortable sharing that they're a caregiver or don't self-identify as a caregiver. And so asking the question the right way makes you get more accurate information. So Facebook, and you would think, you know, Facebook, and they talk publicly about this, but Facebook, you would think, oh, maybe younger workers, tech workers, the number one relationship between employees within kind of their circle of care that employees are kind of involved in caring for is parents. And they learn that through this anonymous surveying. So that's one thing we've seen work well.
Anonymous surveying. Another one wants to know, what are some of the most daunting issues with elder care beyond just housing and health? Liz, do you want to take that?
Well, I think one of the things that people don't realize about elder care family caregivers is how much medical support they provide. And I think that's really important for employers to know. I mean, giving injections, you know, managing medications, cleaning wounds, toileting. I mean, I think people would be shocked how much of medical care happens outside the hospital, inside the home by families. And so if employers, you know, again, back to that compassion, have that understanding, it helps understand where your employee is coming from. And then also training. There's no training. So I think that's a gap that maybe employers could look at too. How do we provide that training to alleviate some of that stress?
Yeah, because that's often the purview of a healthcare provider to do all those things. And all of a sudden we're just thrown into it without knowing. Okay, now we're back to children. How do you deal with the wide spectrum of needs among children so that it's personalized? Hand raise on this one. Otherwise, I'm going to call it. Go ahead, Kerstin.
Yeah, I'm not sure I'm following the question. I was hoping they could elaborate a little bit more.
I'm guessing that it's you know, with a workforce that has kids of all ages and obviously diverse needs, how do you handle it so that it can be personalized? What your offerings are?
Yeah, I think this also goes back to that, you know, when you're looking at your vendors, making sure that there's something for every family, right? Because some families it's preschool, and some families it's after school care, and some families it's now we're faced with what colleges do they you know, apply to, and is there somebody that can look at this essay and let us know, you know, where it needs work or whatever. So all of the families do have different needs, and I think that's something we need to keep in mind when we're valuing each and every program as we're going to launch it. You know, are there edits that we can make so there's something in it for everyone? And going back to the earlier question about, you know, how do you get the message out there? We struggled with that with all benefits, because as humans, if you don't need something right that minute, you screen it out, right? And we have to do that for the most part because there's just way too much information coming at us. So I think you have to have a really regular cadence of reminding people, you know, kind of a rotation of reminding people of the programs. So hopefully they either remember that there was something so they can, you know, search it out, or you're getting them at the right moment when the need arises. But I think that's a challenge for every employer.
Well, that's about all the time we have. For those of you who did not get your questions answered and had specific questions for specific panelists, please feel free to connect with us on LinkedIn or via their company's website, and I'm sure they would love to dialogue with you. And again, thank you for spending the time with me and providing your insights, Lindsay, Kerstin, Liz, Sarah, Diana. Thank you so much. Steve?
Well, thank you, Lydia, and all of our speakers for such a thoughtful and candid conversation. I know there's so many families out there who never expected to wind up in these caregiving situations, but they're a part of life for so many people. Thank you again to our sponsor, Wellthy, and to all of you for participating today. If you'd like to join us for more virtual events, you can head to our website, fromday1.co, and check out more of our upcoming webinars. I'll mention 3 real quickly here. Tuesday, February 15th, we'll be talking about making healthcare more inclusive for all your employees. Wednesday, February 16th, our monthly virtual conference will be titled Beyond Diversity, Bringing Substance to Inclusion and Belonging. And on Thursday, February 24th, we'll be talking about enhancing employee mental health and wellness benefits. So thanks everyone from Day One. Stay well.